Well, thank you. Now I'd like to recognize the Work and Welfare Subcommittee member, representative from California, Ms. Chu, for 5 minutes requesting.
Thank you, Mr. Chair. I want to set the record straight here. For all my Republican colleagues talk about wanting to support people with disabilities, the actions that they have do the opposite. Our nation's Social Security disability programs are a lifeline for disabled Americans, providing basic income for people with severe and long-lasting medical impairments. The eligibility requirements are strict, and the benefits are extremely modest, just $19,000 a year for those on SSDI and $9,000 a year for adults with disabilities on SSI. But year after year, the Trump administration and Republicans in Congress have tried to slash these modest benefits. Just to name a few, during his first administration, President Trump sought more than $70 billion in cuts in Social Security disability benefits, including plans to make it harder for older, severely disabled workers to qualify, to throw disabled people off benefits by subjecting them to more frequent paperwork reviews, and to cut retroactive benefits in half for newly eligible disabled workers. And then, over the past 3 fiscal years, the Republican Study Committee, representing more than 80% of House Republicans, has proposed a slew of harmful cuts to Social Security disability, like reducing benefits to the poverty level, time-limiting benefits, making it harder to qualify, and forcing disabled workers to wait 5 years for Medicare eligibility. And earlier this year, House Republicans included billions of dollars in cuts to SSI on their initial so-called menu of options for budget reconciliation in order to pay for tax cuts for billionaires. So if my Republican colleagues are interested in exploring ways to ensure that Social Security disability beneficiaries who are able to work can do so without losing their vital benefits or their health care, we stand ready to work with you, but not if the main motive in getting them to work is to kick vulnerable people off their benefits. And so, Ms. Groniger, I'm deeply alarmed by the collapse of Social Security's customer service under President Trump. His administration is taking a wrecking ball to the agency, forcing out more than 7,000 SSA workers, or about 1 in 8 employees. My office has been flooded with calls from constituents. They can't get through to SSA on the phones. They're facing long waits at field offices, and they're struggling to get any help from the agency at all. I heard from one constituent who said, "I depend on my disability check to keep a roof over my head and food in my mouth, not just Social Security, but Medicare, Medicaid, and SNAP as well. They all keep me alive and healthy, not homeless and starving in the streets. This is literally a life and death issue for me." So, Ms. Groniger, how can the quality of SSA's overall customer service impact the effectiveness of a return to work strategy for people with disabilities?
I think you've really hit on something in that you must have the customer service as a base if you really want to give people the ability to go back to work. If you can't get information because you've been waiting on the phone for hours, you're not going to trust that you have access to your benefits if you work. Similarly, if you go to a field office and you're told that you have to make an appointment, but then you can't make an appointment and so you can't talk to a person, you're going through all these hoops, it's not going to make people feel as though they can try to work and still keep their benefits. And I think that's the kind of thing that we are worried about and that we've been hearing from advocates. You know, depending on where you are in the country, your experience with Social Security can vary greatly. It may take you an hour, it may take you 4 hours, but it's not good, and that shouldn't be anyone's experience, no matter where they live in this country, if we're trying to say that you can trust that Social Security is going to be there for you and help you if you want to work.
And also, I'm deeply disturbed about the potential use of AI in these complex and high-stakes determination of eligibility. Can you say something about that, the use of AI in Social Security disability determinations?
Sure. I think that AI can be a really useful tool, but it shouldn't be a replacement for experienced staff and people, and especially for seniors and people with disabilities. You have to make sure that you're giving them full access to the customer service that they need. And we all know that AI is not perfect. We cannot have people with disabilities and seniors as test subjects to try out AI. We have to make sure that we're using it properly and that it is serving our needs. The National Academy of Social Insurance actually put together a report around AI and emerging technology and disability specific to SSA. And they talked about the different guardrails and principles that are necessary when you're thinking about how to use AI. One of which is that we can't use AI to make decisions about denials. We can't have AI denying benefits. We need to have people who are looking at these applications, who are talking to people and engaging with people, and not just replace them with AI, because we're not going to be successful.
Thank you. I yield back.
Well, thank you. And I just want to mention that, this hearing's not about work requirements for individuals with disabilities. We shouldn't be framing it that way. I mean, disabled individuals have always been exempt from work requirements in federal programs, and that will continue to happen. We want to look forward to being able to talk about opportunities for folks that want to return to work and how they can do that. And kind of how do we get past this trap system that we're in now, making sure the federal programs aren't an obstacle to being in the way of work. So